So we are discussing about esophagus. Esophagus starts at the level of C6, where laryngopharynx ends and esophagus starts. It ends at the level of T11, where esophagus ends and stomach starts. Esophagus runs through a course where it passes from neck at C6 level, passes through superior mediastinum where it is behind the trachea with the recurrent laryngeal nerve in between. That is the important relation. And then it passes through posterior mediastinum. In posterior mediastinum, the aorta is on its left side, crosses laterally. Then at T10 it pierces the diaphragm, and at T11 it joins the stomach. At the lower end, upper end there is cricopharyngeal sphincter, at the lower end there is cardiac sphincter. Some significant points about esophagus which you should be knowing: that there are 4 constriction which is measured from the distance from the incisor teeth. So while Ryle's tube has these 4 markings, first marking is 6 inches from the incisor teeth, cricopharyngeus. You feel the resistance while putting the Ryle's tube. Second is where it is crossed by arch of aorta at 11 inches. Third is at 9 inches. Third is when it is crossed by the left bronchus at 11 inches. And fourth is when it pierces diaphragm at 15 inches. That is one. Another is esophagus. The blood supply, upper part is from inferior thyroid, middle is from the arch of aorta, lower is from the left gastric artery. Venous drainage. The lower part drains into hemiesophagus and left gastric. Left gastric is a part of portal circulation. So lower end of esophagus is a site for portocaval anastomosis. So in case of liver failure, this veins will dilate. This is called esophageal varices, may burst and can lead to hematemesis, which is kind of an endpoint. Esophagitis, the applied anatomy of the esophagus is esophagitis, where acid damages esophagus. And 2 is TOF, T-O-F, the tracheoesophageal fissure, because they develop from the same source, trachea and esophagus. Sometimes the separation is incomplete. This leads to TOF. So there are multiple types of TOF. Okay, sometimes connected like this, not from here. Typically, a patient will cough out. The newborn, moment is fed milk, it will cough out. So that is TOF. Thank you.